My patient's room. Knock, knock. Hi, my name's Lincoln. I'm a student nurse with Tarrant County College. May I have just a moment, please?
Yes.
Thank you. I'm gonna close the door, pull the curtain for privacy, set my stuff down, perform hand hygiene for 20 seconds. I'm gonna don clean gloves. I'm going to cleanse the bedside table with the germicidal wipe. Allow that to dry, bring it up to a working height. And then I'm going to take off my gloves, bring up the patient's bed. May I get your name and date of birth, please?
Corey Green, 12/30/74.
Awesome, thank you very much, Miss Green. Now, do you have any allergies that you're aware of?
To penicillin.
And what happens when you take penicillin?
I break out in hives and itch all over.
Oh, luckily that's not on the menu for you today.
Thank goodness.
Now, a few other questions of allergies. Do you have any, are you allergic to any tapes, adhesives, lubrication, latex, or iodine?
Not that I'm aware of.
Awesome. Okay, cool. So I've established who I am. I've established who you are. So you're probably wondering why I'm here. I got an order from your doctor to matches. I got an order from your doctor to insert what's called a Foley catheter. Have you ever had one of those before?
Yeah, I've had them when I had my babies.
Oh, okay. So it's going to be the same process. So I'm going to put the tube up in through your urethra. That's where the urine actually exits your body. And then I'm going to inflate it with a little balloon to make sure that it doesn't come out. And after that, I'm going to give you a little more instruction. But the reason why you're getting it is because you're going into surgery for your, you have a bowel obstruction that they're going to be working on. So they want to make sure that your kidneys and your bladder are working as they should be, okay?
Okay.
So, that being said, you are going to be attached to a bag. You do have some experience with this, but just so that way we're on the same page. That's going to be connected to your bed, so if you do get up, I'm going to need for you to call for help, so that way we don't pull and tug, because we don't want to be pulling and tugging on this, because that'll hurt a lot. You want to make sure to keep the bag below your bladder, so that way gravity will help it come out, and there's no risk of like backflow or anything. And make sure that it does not touch the ground, okay? We want it to stay germ-free. And you're gonna wanna drink a lot of water and cranberry juice if that's your thing. Just make sure to stay away from like soda pops and the unhealthy stuff.
Okay.
So from here, are you able to independently clean your perineal area?
Yes.
Awesome, cool. So I'm gonna give this to you. Go ahead and clean that. And while you're doing that, I do have a few other questions for you. Do you know if you've had like a prolapsed bladder or uterus or anything like that?
Not that I'm aware of.
Cool, awesome, congratulations. Now, are you able to move your legs by yourself to get into like a butterfly position?
Yes, I can do that.
Oh, awesome, sweet. This is gonna be just dandy.
Yeah, we'll make this easy.
Cool. So performing hand hygiene again. Getting my supplies on over. Actually, just to the table. And I'm going to visually inspect the perineal area. And I'm not seeing any sort of warts, lesions, anything that would impede the actual insertion of the catheter itself. Patient is able and willing to participate in the procedure. So she's cleaned herself already. So it's time to get set up.
Okay.
So again, hand hygiene. I'm gonna ask the client to assume the position. Hand hygiene once more. Now from here, I'm going to prepare my tape.
Okay.
Alright. Got our clean gloves, sterile gloves, and our catheter tray. I'm going to use my third arm
Okay.
to bring my trash can over. Now I'm going to get my catheter tray out. Set it approximately the heels. And we're going to do the first drape away, making sure to stay on the 1-inch border. And the last one towards me.
Okay. Make sure it's set up right. You also have the extra steps. You don't need that. There we go. Got the extra drape out for you.
Okay, thank you. So, from here, we're going to go with the shiny side down. Making sure again to step back, pivot about here, only touching that 1-inch border. Doing it long ways, like a bullfighter. And then arms out. Okay, from here, hand hygiene. Now with everything still in view, I'm going to put on my sterile gloves. So, I'm going to do the furthest flap away first, then the closer flap, touching only the 1-inch border. We're going to go in a triangle. And we're going to do our dominant hand first. So we're going to come about here, making sure she's not scratching or touching or moving, shifting around. Then we're going to take our gloved hand, come inside the cuff. You can touch the 1-inch border. And then we're going to put on our second glove. Pray out. Now from here, we are going to remove the one-size-fits-none gloves. Making sure to keep everything
You can sit on the table. It's fine.
in view. Thank you. And now we're going to do our fenestrated drape.
Okay.
So from here, I'm going to bring it over the area, hands come out, and now we're going to set up our field. So I'm going to open our swabs. This goes in the trash. The 3 swabs are going to come out. And this also goes in the trash. Now our lubrication as well. Oh, thank you. Going to get our lubrication out. And that's going in the trash as well. We're going to take our saline flush out and set it to the side. And we're going to move the top tray closer to the patient. Doctor did not order a specimen sample, so this set off to the side. We're going to unsheath
Okay.
our catheter.
All right.
Make sure to wrap it around the finger. Okay. going to use our third leg to bring this over here in the trash. Going to put some lubrication on and set it back into the tray. And then after we do that, we're going to attach our flush to the tubing. Okay. So from here, we are going to clean the urinary meatus, expose and clean it. So I'm going to use my non-dominant hand to hold the labia open. It is no longer going to be sterile.
And just do the best you can. We know it's kind of hard to hold.
Okay. So we're going to start off with our first swab, going from top to bottom on the labia that's furthest away.
Okay.
And that's going around the sterile field into the trash.
Okay.
I'm going to rinse and repeat with the labia that's closest to me now. Top to bottom. Again, coming around in the trash. And then for our final swab, we're going to go down the middle. Again, tip down in the trash. Now, from here, it's game time. So, going to make sure that we are well lubed again. About 2 inches onto the catheter. And I'm going to ask my patient to bear down as if she was getting ready to urinate.
Okay.
And we would insert. And back it up. Keep inserting until we see urine.
Okay, you see some urine.
Okay, cool. Then we're going to advance it another 1 to 2 inches just to make sure of placement.
Okay.
Then I'm going to back my hand up, giving it enough space so that way if we do need to advance further, which we don't, but we could, I'm going to let go of the genitalia, hold on to the catheter tubing, and then let go with my sterile hand, and then fill the balloon. Now, after filling the balloon, we're going to take the fenestrated drape, use it to cover the tubing to pull the syringe off. It's going to go in the trash. And then I'm going to take the fenestrated drape off. I'm going to wall it up and then discard my sterile gloves. Left glove. Skin to skin. Trash. Now, the sterile part of the procedure is done.
All right, dude, hurry up.
So just for good practice, I'm going to do hand hygiene one more time. And then I'm going to don my clean gloves. Which is, and now we're going to secure the catheter to the patient, which entails putting one piece of tape directly on the patient's skin, making sure there's enough slack so that the patient can move about approximately where the tube starts to bifurcate, and then put another piece of tape over that just to hold the tubing in place. Then we are going to put the tubing over the patient's leg, making sure she does not lie on it. Don't lie on it, that could cause skin damage. And then connect it to the bed. Found it.
I know some, they're kind of hard to get on and off.
Okay, now from here, I would clean up my supplies and ask the patient about pain. On a scale of 1 to 10, how much did this hurt at all?
A little uncomfortable. I guess a 1, I would say.
Okay, I can deal with a 1. And then I would note the amount that came out of the patient upon insertion, which is approximately 150 milliliters of clear to pale colored urine.
Okay.
And then I would ask the patient if she had any questions.
Okay. No, I don't have any questions.
So I'm going to be back to check on you in about 30 minutes.
Okay.
Again, don't get up. Don't be pulling and tugging on it, everything we discussed. I have your call light right here. Are you comfortable? As relatively comfortable as you could be?
Yes.
Okay, awesome. So, gonna leave the patient in a safe position with side rails up, bed in the low position, and call light within reach, and personal belongings are also within reach. Sorry about your toes. And then I would clean up all this down here. Hand hygiene. Grab my order, doctor's order,